The most tried and tested way of overcoming anxiety is to actually face your fear. A term that we might use very broadly to describe this is an exposure. And an exposure is something that can be more casual. You don't necessarily need any special tools or skills, or it can be a very clinical procedure. So today we have Jessie here to tell us a little bit more about how this might be used in eating disorder treatment. I'm curious, Jessie, can you tell us a little bit more about what exactly an exposure is and how it works?
So I like to think of exposure as learning by doing. So if there's a fear that you have that you've been avoiding, it's actually interacting with that thing you've been afraid of. So really quick example, if you have a fear of dogs, an exposure would be being in the same room as a dog. You might have to start even a little bit smaller. Maybe it's looking at pictures of dogs or watching videos, but that's kind of it. It's doing the thing you're afraid of. And the reason why it works, and it works really, really well, I love doing exposures, is because there's just nothing quite as powerful to teach you that that thing you're afraid of doesn't actually happen as doing it, learning through experience.
Definitely. When do you commonly see exposures happening in eating disorder treatment? And is there a best or right time?
It's a great question, and I get this a lot. There are so many ways exposure could be used in eating disorder treatment. We see it being used to help with treating body image concerns. We see it being used to help with challenging food fears or really rigid food beliefs or rules that the eating disorder has. We see it being used to treat fears of vomiting or choking or fears of having an allergic reaction when you eat. There's a whole host of uses for exposure. Now, the best time to do exposure is typically, we usually save it for a little later in treatment. It can be hard. It can be a tough procedure, very effective, but really hard. And so we like to see that we've kind of established some foundations first, like just getting eating going. We want to see there be a little bit more weight gain because we know that exposures actually work a little bit better the higher your weight is. So those are the two things we like to see happen first before we start exposure.
That makes a lot of sense. And I can imagine there's families listening in right now who are wondering, is there anything they can do right now, today, to start this process?
I think there's never a wrong time to just try little challenges. So, exposure works best when we kind of start slow, break it down. And if there's something that you've kind of been hesitant about, or you're unsure if you should push it, or if your child can handle it, try it out. It can never hurt to try. It's really important to remember that those little things that we've been avoiding, we've got to face those fears if we're going to make it through recovery on the other side.